right, hi, I am Chastity Farr. I'm a clinical psychologist, and today we're going to be talking about sexual behavior in children and adolescents. Some key topics that we're going to cover broadly would be understanding sexual behaviors across developmental ages, identifying normative, concerning, and problematic sexual behavior along a continuum, recognizing digital risk behaviors, and this continuously changes, as we go on. So pornography, sexting, social media, AI, you can add to this as well. And providing age-appropriate ways to respond to children. Some key concepts that really go across is that sexual behavior is developmentally driven. So this applies even to very young children, that typically their behavior is driven by curiosity versus sexual intent. And that the behavior consists along a continuum. So you have the normative behavior, then you have concerning behavior where you would likely want to ask more questions and get more information, and definite problematic behavior where you may seek professional intervention. No single behavior should lead to an automatic assumption that someone is a victim or a perpetrator of abuse. Certainly that does happen. However, someone shouldn't be labeled that just because of one behavior. Some red flags consistent across sources is that coercion and force is never normative, and that's across ages as well. Age developmental differences is also an important distinction. Typically, that's a 2-year age difference, but you would want to know your own state laws. Persistence in sexualized behaviors despite redirection by adults is also something that across ages is of concern and potentially in the problematic area. Lastly, context matters. So when is the sexual behavior happening? What is the family environment? Are there boundaries? Is it a supervision issue? What is their exposure to social media or regular media? Trauma potentially, abuse, and generally what the supervision is. So I'm going to start by talking about what problematic sexual behavior looks like. So this is going to be behavior that happens very often, not occasionally, and certainly, this has to be coupled with other things such as social norms. So they're engaging in behaviors publicly that generally socially would be only accepted privately, and persistence, that they continue despite consistent redirection from adults. Any aggression or coercion, so force, threats, manipulation, or a lack of consent, which we'll talk about as we move forward. And age-inappropriate knowledge, so behaviors reflecting adult sexual acts that are beyond their developmental level. So you're not going to see, toddlers simulating adult sexual acts unless they've been exposed to it. And then cultural context. You want to consider the family norms, the culture in which, you're practicing, and the issue may be about boundary setting and supervision versus sexual intent. So we're going to start with early childhood, and I have split these up into early, middle, and late childhood and early, middle, and late adolescence. However, keep in mind that there's always some overlap, and they're not discrete categories, and it sometimes depends on the maturity of the child as well. So for this age group, 0 to 5, so this is toddler age, genital touching during diaper change or at bedtime is pretty normal. Any nudity or bathroom curiosity is also normative. So that would be like if the mother takes a bath with her child and they're asking, questions out of curiosity, that's, pretty typical and easily redirected. So that's pretty normative behavior at this age. Some concerning behaviors to keep your eyes out for would be public touching after redirection, after saying, no, that's not, okay, and that's for private, or boundary testing where you have told them, that you need to have the room alone and they continue to push the boundary to want to view others, and any type of stress-related sexual behavior. So the last thing that you want is a child to use this as a coping mechanism. So certainly you don't want to have those two things paired. Problematic sexual behavior at this age would be sexual act imitation. So you'll see this with playing with dolls, simulating a sexual intercourse, for example. Persistence despite intervention, as well as coercion of peers. So that would be a problematic and would suggest potential exposure to either explicit sexual acts or abuse. How to respond as an adult to this age group. You want to stay calm and neutral, that children mirror your interaction. So you want to meet the kid where they're at. Use simple language, but use accurate language. So use the proper names for body parts, and you want to redirect gently and not shame a child, as well as increase supervision if needed, and teach body safety rules. So good touch, bad touch, where bad touch would be touching underneath the clothes in the private areas without consent, or typically that might happen with a medical professional when the parent is present, but outside of that, anything that made them feel uncomfortable. So now we're going to talk about middle childhood. So this is 6 to 9 years old. Again, I didn't include puberty here. However, for some girls, they may reach puberty at the end of this age group. So that is a possibility. So just keep that in mind. This may overlap with late childhood for some. So it's normative for there to be body exploration play, playing doctor with friends, having curiosity about the opposite sex. And you'll see a sense of privacy emerging at this age as well. So some concerning behaviors would be age-inappropriate sexual talk, advanced sexual knowledge. So you're not going to typically see this age group discussing, sexual acts explicitly or graphically without them having been exposed to it previously. Repeated nudity seeking. There is a curiosity, but it shouldn't be something that seems obsessive or compulsive. Any shame or secrecy surrounding the sexual behavior, and any early exposure to explicit content, so pornography, for example, would be concerning at this age and would require an adult to really step in and provide some psychoeducation and talk to them about critical thinking, which seems a little bit off for this developmental period, but certainly would need to happen if that were the case. And problematic behaviors would be explicit reenactment. So it might be playing with dolls and now they're undressing, and there might be abuse happening, between the dolls for them to kind of be able to express something that may have happened to them, for example. And persistence in sexualized behaviors despite redirection. So if you're saying that's private, that's a private area, that's not appropriate, and they continue. How to respond as an adult? You want to discuss online safety. You've got some kids at this age that can navigate computers better than their parents. So you want to talk about what to do if they're approached by a stranger online, what information not to provide because of safety, so their address, and really limit pictures of themselves to others online. We're approaching an era with AI, deep fakes, and that type of thing. So certainly keeping that in mind, encourage questions and just meet them where they're at, answer their questions. It can be overwhelming if you try to provide them all the information that related to this area. So kind of just meet them where they're at, answer what they ask. Reinforce privacy and boundaries. So accepting no for an answer, for example, and normalize that curiosity because sexuality is normal. So late childhood, this is going to be when puberty typically happens for most, but again, keep in mind that it could happen slightly earlier for girls. So puberty, curiosity, having crushes on others, increased privacy needs is normative at this age, and some curiosity about sexual content, what the opposite sex looks like. It is concerning if there's intentional viewing of sexual content. I want to clarify, though, that you want to know what they're looking at and how long or how much time they're spending on that material. So if they are spending a lot of hours online looking at abusive, pornography, that is certainly goes into the problematic range, right? But if they are just curious, you want to normalize that and, meet them where they're at and discussing that honestly. Boundary pushing or sexualized language. So this would be, again, not accepting no for an answer, trying to coerce individuals to, engage in sexual behavior when they don't want to, and risky online behavior. So that would be meeting strangers that they think is another child, but maybe an adult online, or that they are sending pictures of themselves to someone they don't know, but they have just been communicating with. So it is really important once your child has a phone or access to a computer that as a parent, you are really overseeing what they're doing online. And that can be hard. Kids can be savvy. And so you want to keep up with the trends and make sure that you're discussing this honestly. It takes, the risk out of it if you're bringing it to the forefront, and they're more likely to pursue healthy relationships. Some problematic behaviors would be coercive, manipulative behavior, and that, again, across ages. Sexual contact with younger children, so they're 10 to 12. So kids under 10, would be considered prepubescent for the most part, and that would be problematic. And non-consensual or compulsive sexual behavior is also problematic. So how to respond is you're providing accurate, shame-free information. Don't let the internet be your sex education for your child. Model consent and healthy relationships with your own relationships. Talk to them about consent. Talk to them about ongoing consent, that just because someone, says okay on Monday doesn't mean they're going to want to do this on Tuesday or Friday or even the whole day Monday, etc. Talk openly about puberty, pornography. You want to really start the discussion related to critical thinking, especially when it comes to pornography. So keeping in mind that what they're seeing is usually not the real world, that these are actors a lot of times, and sometimes what they're looking at is illegal. So teaching the sex laws is also critical to start at this age, because especially with the increase in kids being adjudicated for sexual offending online, it comes down to many don't know what they're doing is wrong. And even sharing their pictures of themselves can be considered child pornography at this age. So monitoring online activity is key throughout their childhood. And that can be tricky to do, and you want to continue to seek help from outside sources, making sure they're not hiding apps, making sure they don't have a second Instagram, for example. Keeping up with trends on TikTok would be another. But you're going to want to really know about sexting, and we'll talk about that a little bit later. Age of consent in your state, and digital risk and exploitation by others, making sure that they're not sharing things that should be considered private. So early adolescence is going to be ages 13 to 14. And again, remember, there's some overlap when you start to go early, middle, late adolescence, and even late childhood. So normative, they're curious about bodies, relationships. You'll see masturbation occurring privately at this age and maybe earlier. It really kind of coincides with puberty for the most part. Crushes, romantic interest increase. You'll see consensual kissing, light affection with same-age peers. You will see a small percentage at this age engaging in consensual sexual intercourse with same-age peers. So you're really wanting, it kind of depends on the maturity of the child, the culture in which, they're being raised as well. So you're really wanting to know who your child is interacting with regularly, who they're spending their time with. And they'll have questions about sex, puberty, sexual identity. You're definitely wanting to normalize that it's okay if they don't know if they're heterosexual, homosexual, bisexual at this age, but that it's okay to ask questions. It is concerning if they are engaging in disruptive sexual talk or jokes. You might see some kids being the class clown, trying to get attention. That is one thing, and you just want to probe for more information. But that typically can fall back in the normative if there's, nothing additional. And sharing and requesting sexual images without understanding the consequences, unsolicited images of themselves, or even any images of themselves that are sexual is considered child pornography at this age. So early sexual activity without understanding consent, boundaries, safety, pregnancy, for example, sexual education, making sure that they understand these things before they're engaging in sexual activity, and in using sexual behavior to cope with stress. Again, this is the same thing that kind of I talked about early on, that you're not wanting to pair those two things, or with anger, for that matter, because right now they're still developing patterns, but those haven't set in yet, so you're just wanting to intervene if that is the case and they're using it to cope. Problematic would be coercing, pressuring peers, sexual behavior with much younger children, and repeatedly accessing explicit content or pornography despite supervision or consequences, especially the pornography that is abusive, illegal, is of concern here. So the primary goals in terms of how the adult should respond center around education, healthy boundaries, safety, and emotional regulation. So you're wanting to normalize that curiosity so that they're not so embarrassed to discuss it with you and that they're being open. You really just want to keep that line of communication open with the child, setting privacy, consent, and digital limits. So you can do that with the various apps, as well as limiting time that they're spending online so that they're having that social interaction in real life with others. Providing very clear sexual education. Usually by this age, they've had it in school to some degree, but you want to make sure that they understand. And this coincides really with puberty. Once a child hits puberty, you're wanting to go into the sex laws, sex education, because you're wanting to do that before they're entering a situation where sexual activity is going to happen. Supervised digital use, and this can be tricky, and parents have to stay on top of it, certainly because of things are ever changing. And, they say that limiting child photos or sharing of child photos with AI, with deep fakes coming around the corner, making sure that that is limited to prevent or minimize that. Responding calmly and simply and not making a huge deal or shaming them is important across age groups. If the behaviors concerning are problematic at this age, you're wanting to increase supervision, talk about consent, and there's a great video online called Tea and Consent. And it's just kind of like if someone wants tea on Monday, then you might make them tea. Like boil the kettle, boil the water, give them tea on Monday, but it doesn't mean that they're going to want tea on Tuesday. So if they don't want tea, you don't go to the trouble of getting ready to give them tea. It's a really great example of consent and how it's ever changing and it's not a static factor. Boundaries as well, healthy boundaries, not having, boyfriends or girlfriends who are controlling, who are manipulating, and same goes for the child. And safety online is incredibly important. Seeking help when there's coercion, compulsive behavior, or harm that's present. So now we're going to talk a little bit about middle adolescence. And again, it overlaps with the other two, early and late. So you're going to see more dating, more peer consensual exploration, private masturbation continues, and that starts with puberty typically. They're developing their sexual identity, so you're wanting to be open with them at this age about, what that means. And talking with peers about sexual behaviors, and so they may have attractions, need to understand boundaries, that's normal. And seeking information on contraception and sexually transmitted diseases, consent is also normal at this age. Concerning behaviors would be risky, promiscuous sexual behavior, so unprotected or impulsive behaviors. This comes down to a lot of times in families, their value system, and you're really wanting them to respect their own bodies and make sure that they're not just allowing others access that don't deserve that. Pressured sexting is also something that is of concern. So looking at what your child and who they're communicating and how they're communicating is important. And, if the child can't say it to you or they don't want you looking at it, they shouldn't be doing it, is kind of a good rule of thumb. Sex plus substance abuse is also of a concern because we know that if someone is incapacitated, that they cannot consent. And sex for approval or status. And this may be more for boys than girls, but it, varies. So that shouldn't be the reason why they're engaging in sexual behavior. Problematic sexual behavior at this age would be non-consensual sexual behavior. A sharing of sexual images, again, is still considered child pornography, even if it's of themselves. And they can be arrested for that and found guilty and sent to juvenile detention. So that is something to really talk to them about. Threatening, manipulating, or forcing others into sexual interactions is definitely problematic, and compulsive sexual behavior. So that's uncontrollable, impulsive sexual behavior that occurs. That would be problematic as well. In Alabama, the age of consent is 16. Depending on what state you live in, you should know the age of consent. I know in Georgia is 17. I'm not sure about Florida. I want to say they're 17 as well. But you want to know the age of consent. And generally, it's a 2-year age gap. So if they are 17, really, they should only be going out with 16-year-olds who can consent if their sexual behavior is occurring. If they're 18, 16, at the very least, if not older. And, so you're not wanting really a 17 and a 14-year-old would not be appropriate. So that would be of concern. So that would be like a 9th grader and a senior. So just keeping that in mind. Primary goals during this in terms of response is talking about consent and how that's ever changing. Risk reduction, risk of STDs, pregnancy, and autonomy, teaching them independence with some accountability as well. So share decision making to build that healthy autonomy. What are some rules that they want to have for themselves, to value themselves and feel good about themselves, as well as consent that goes across just verbal consent, but also digital consent online, and respecting others' boundaries and not pressuring people to engage in behaviors or not accepting if someone's pressuring you. So you want to address peer pressure and social dynamics. So reputation, for example, can be very hard to get back if lost as a child. So just keeping in mind that, what do they see themselves in terms of their value system would be an important discussion. And discussing pornography realistically, and I talked about this a little before, being critical thinkers, understanding that what they're seeing online is not typically realistic, not to expect that just because someone looks like they're enjoying it doesn't mean they do. And supporting identity development. So their sexual orientation, gender, their relationship expectations as well. Keeping in mind that you're wanting really to instill what is a healthy relationship and what is an abusive, controlling relationship. So if behavior is concerning or problematic, so that could be coercion, manipulation, or power imbalance. So that would be something like, a gym teacher and a student, a coach and a student, someone who has authority over that child. You may also notice risky patterns. If the behavior is concerning or problematic, unsafe sex, promiscuity, substance-linked behavior, for example, blacking out, and not knowing what happened is certainly of concern. Seeking help if behaviors involve non-consent, absolutely if they involve younger children, or compulsive behaviors. Late adolescence, this is 17 to 18. So this is, commonly when consensual sex with similar age peers occurs. However, keep in mind that there is a percentage that start that at 13 to 14 and 15 to 16. So it really depends on maturity, the culture in which they're raised. And you're going to see increased autonomy and decision making. That is normal at this age. They're becoming emerging adults. Seeking contraception or sexually transmitted diseases, care for that, as well as exploring what their identity is and their sexual orientation. You'll see more privacy with dating. And of concern would be risky sex, so unprotected, definitely those linked to substance use, so intoxicated, anonymous sex with someone they just met and they don't even know their last name. Sex used to cope with distress. Again, you don't want to pair those two things and make that a coping mechanism. You want them to learn other ways to cope with negative feelings. Having poor boundaries, so allowing others control over them or their life or their behaviors is certainly a red flag. You want to get more information and really talk to them about what is appropriate. And jealousy and control in relationships is also of concern at this age. Problematic behaviors would be coercion, assault, exploitation. That kind of goes without saying, right? But that is across all ages. Creating, sharing sexual images of minors. They are still minors at 17 years old. And so that is certainly child pornography as well. Power imbalance sexual behavior. So again, a coach and a student, a teacher and a student would be one example. Primary goals as a parent or guardian would be helping them transition to adulthood and be more autonomous, right? And healthy relationships, what that looks like. Kids do what they know. So if you have showed a pattern of unhealthy relationships, they are likely to mimic that. And so it's important to be really open about things that you've done wrong, if that's the case, and what, a healthy relationship looks like, so they have a model to go by because sometimes they just don't know. And legal awareness. And I've talked about that, from puberty on, you really should be talking about the sex laws. They often don't teach that in school. And so it is important for them to know so they don't find themselves in a legal situation. So like I said, treating them as emerging adults, emphasizing that responsibility. At this age, their brain is still developing. We know that happens until mid-20s. So there's short-term reward versus long-term consequences, right? So you want to have them start to think about what this means long-term for them and how to manage themselves so that they can, leave the home and act appropriately. And focusing on relationship skills. Again, what is a healthy relationship? What does emotional abuse look like? It can really be something that seems minimal and nuanced. And so you want to really, keep eyes on who they're hanging around. It is healthy for a kid if they have a girlfriend or boyfriend to also spend time with their other friends. If they're having a boyfriend or girlfriend who's monopolizing their time, that certainly is a red flag. How to respond would be to support access to sexual health services, contraception, testing for sexual transmitted diseases, confidential care with their physicians or primary care doctors is relevant. Encourage, like I said, future-oriented thinking. Keeping in mind, things you put on the internet never really go away, and employment, colleges, they look at that for admissions, and so you just want to make sure that they are keeping in mind that what they do today as an 11-year-old could impact them as a 21-year-old or 18-year-old. Use restorative practices, so some accountability where they are responsible for their actions paired with skill building, how to create a healthy relationship, how to set boundaries with someone who is trying to encroach upon yours would be important. If behavior is concerning or problematic, this would include things like dating violence. Of course, this seems obvious, right? Coercion, exploitation for money or for status, for example. Consider legal implications that some behaviors might need to be reported to the police and seek help if behavior is harmful or persistent. So let's talk for a minute about pornography use. You should not ever think if a child is going to be exposed to pornography, but when. All kids are, even if it's not in your home, another kid will show them. So you should expect this. So this discussion should begin early. At puberty is ideal. So this is going to be exposure in adolescence is common. Most by age 15 have seen pornography, and this increases with age. However, research shows most users of pornography don't show sexual aggression. However, we know that use shapes attitudes, beliefs, behaviors. So if they're watching abusive, illegal pornography, that can certainly impact what they seek out later. So the link is unclear with regard to research, but you want to know what they're looking at and be really realistic about it and really encourage them to be critical thinkers. How to respond? Like I said, responses should be realistic, critical thinking, and should include education about what healthy sexuality looks like. That, objectification of women is not okay, that they have other value outside of sexual behavior. Not accepting this idea of boys will be boys and, that what the girl's wearing impacts whether she's assaulted or not. And that goes both ways, both genders. So really talking about how to value others for other aspects outside of sexuality. Social media. This is an ever-changing field, so you have to stay on top of it, on top of trends. So the use of social media to engage in sexual behaviors is very common. Sexting emerges in early adolescence, and our social media risks peak around mid-adolescence. So the minute you give a kid a phone, you need to be talking to them. If they're not mature enough to talk about this, they don't need to have a phone, is probably a good rule of thumb. There's an Association for the Treatment and Prevention of Sexual Abuse that does offer guidance about how to talk with kids with respect to pornography, for example. So it's guidance, boundaries, how to reinforce safety, use supportive correction and not shame. Because if you use shame, they will stop coming to you to talk about it. And you don't want to close that line of communication. And understanding that just because a behavior happens doesn't mean that's who they are, that they really are about more than just that. And so they can really recover from that if needed, if they've engaged in something that is not appropriate. So some tips and takeaways. Sexual development starts in infancy. We are sexual beings. This is normative, so it continues throughout childhood. Most children are curious about the world, including bodies and the differences in their bodies, and that's completely normal. Sexual knowledge and behavior is absolutely influenced by culture, media, and peers. Even now, it has changed from years ago with respect to just primetime television. There are many opportunities to bring up and talk about how this isn't accurate, how this isn't appropriate or this is what a healthy relationship looks like, and this is what one doesn't, just by general media use. And children with developmental disabilities and medical conditions, remember that they are also sexual beings, and so they would benefit from knowledge through sex education as well. So not to treat them as if that is not an aspect of them. Both boys and girls can show problematic sexual behavior. Seek additional support if the behavior doesn't change in response to typical parenting strategies. And we know that for kids, if they engage in illegal sexual behavior with treatment, that can prevent future problematic sexual behavior and really stop that trajectory into adult sexual offending. I want to thank you for your time and attention, and that is the end of our discussion.